you?
Good, how are you?
How can I help you?
I have a dental exam appointment.
Okay, let me put you into a room.
Hi, how are you?
Good. Nice
I'm
to
Dr. Feynman.
I'm Sarah.
Nice to meet you.
This is Jealousy.
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 And this is Jess, one of my surgery technicians.
How are you?
So what can we do for you today?
My concern is Jealousy's breath issue. She has very bad breath.
Is that right? Okay. Has she been having any trouble eating or food?
No.
Oh yeah. She's definitely got a lot of tartar.
Mm-hmm.
Have you looked? Have you seen her teeth? See all this gray, brownish stuff right here?
Yeah.
So that's all tartar, and you can see that the gums are actually starting to pull back from the tooth roots.
Mm-hmm.
And in places, the gums are actually starting to overgrow the teeth. That's called gingival hyperplasia. That just makes a deep pocket where bacteria and food can get trapped in there, and that's going to accelerate the periodontal disease that's causing the damage.
Is it serious?
Well, it can be. So when you have the infection that gets underneath those pockets, it's the bacteria are secreting waste products that are very destructive, and they'll start to erode the tooth roots. That's going to create infection that is, number one, it's going to cause the tooth roots to become loose.
Mm-hmm.
The body is also going to pick up the infection from the mouth and take it through the rest of the body, so it can go to the lungs and the heart and the liver. So that's definitely something that the longer we leave it simmering in there, the worse that whole process is going to get. So I would definitely recommend a dental cleaning for her.
Well, let's do that for sure.
Okay. Are you familiar with the procedure? Have you ever had a dental done before?
No.
Okay. All right, so I can go through everything with you step by step, make sure you're comfortable with the whole process.
Okay.
And then we'll get you a ballpark estimate so you can kind of prepare yourself, and we'll get it started.
Okay.
Okay?
Perfect.
On the evening before your pet's dental cleaning, you will withhold food after 10 p.m. Having an empty stomach reduces the risk of reflux during anesthesia or nausea afterwards. That morning, the technician will bring your pet into the treatment area and place an intravenous catheter. The IV catheter allows us to administer your pet's medications and fluids during anesthesia and gives us venous access in case of an emergency. The surgeon will examine your pet and administer a sedative injection. The pre-surgical sedation calms your pet's anxiety, but also serves to reduce the amount of anesthesia medications needed for the procedure. This reduces the anesthetic risk and minimizes nausea and drowsiness afterwards. 10 to 20 minutes after the sedative, your pet is ready for anesthesia. The doctor will call you and let you know that we are ready to start. An injectable agent is given through the IV catheter very slowly. We only give the minimum amount that is needed to achieve relaxation. At that point, a tube is inserted into the airway and connected to oxygen and the inhalant anesthesia. The tube has an inflatable cuff to obtain an airtight seal. As an extra precaution, we pack the back of the throat with gauze. The endotracheal tube prevents leakage of water into the airway during anesthesia and allows us to help your pet breathe if needed. The pet is placed on a warm water blanket lying on their back with a table inclined to ensure that the water used during the dental would drain safely out of your pet's mouth. Immediately, we will attach an anesthesia monitor which tracks your pet's blood pressure, oxygen saturation, temperature, and ECG. Intravenous fluids are administered throughout the duration of anesthesia, and the fluid line is routed through a warmer to help maintain normal body temperature. A penicillin injection is administered to prevent infection caused by disturbing the oral bacteria during cleaning. Low body temperature or hypothermia is a major cause of anesthetic complications, so we are very careful to provide comprehensive thermal support. The dental cleaning can now begin. We use an ultrasonic scaler, which essentially vibrates the tartar off the surface of the teeth, both above and below the gums. Particular attention is paid to the insides and backsides of the teeth, which are harder to see. After removing the tartar, the teeth will be polished. This is not just to make them shiny, but also to eliminate any microscopic scratches on the enamel that could cause tartar to reaccumulate. If the teeth are cleaned and scaled without being polished, the bacteria can actually grab onto those microscopic scratches and the tartar will come back even faster. Once the teeth are cleaned and polished, the doctor will do a thorough oral exam. Using a magnifying scope, each tooth is examined with a small probe. We are looking for periodontal pockets, chips in the enamel, or looseness. Any abnormal findings are recorded in your pet's permanent dental chart. We will also note any growths on the gums or under the tongue that may need to be addressed. After a visual exam, dental x-rays of the entire mouth are done. This is the most important part of the dental procedure. 90% of dental problems begin below the gums. This means that the teeth can look completely normal to the eye even if a serious problem is going on. For this reason, we can never be certain whether any pet's dental procedure is going to be simple or complicated until we have completed the entire exam and x-rays. We use a digital dental x-ray so the images are available in seconds and can be electronically saved to your pet's permanent medical record for future reference. The cleaning, polishing, exam, and x-rays usually take about 1 hour to complete. At this point, the doctor will call you and review any findings that may require additional work. If problems are found, every effort will be made to preserve the affected teeth for as long as possible. If extractions are needed, we will begin with local nerve blocks to numb the specific area of the mouth where we will be working. Using a local anesthetic allows us to use only as much general anesthesia as needed to keep the pet asleep, which minimizes stress on the pet's body and minimizes anesthetic risks. It also helps to eliminate pain for up to 18 hours afterwards, reducing the need for pain medication that can make the pet sluggish and drowsy. Once the nerve block is in effect, we can proceed with extractions. Unless the tooth is already extremely loose, we will begin by making an incision in the gums and pulling them back so we can access the tooth roots. If the tooth has multiple roots, it must be divided into sections and each root extracted individually. This is because the roots point in different directions, and if we attempted to just pull the tooth out directly, we would end up breaking the roots and leaving root fragments in the bone, which could cause an infection. Once each root is removed, we use a contouring burr to smooth any sharp bone before closing the gums over the extraction site. Very small dissolving sutures are used to close the gums. After we finish any extractions and the incisions are closed, we will apply a periodontal filler gel into any periodontal pockets the pet may have. This is an antibiotic gel which dissolves slowly over 2 weeks. This helps to heal the pockets and prevent food particles and bacteria from getting trapped in them. At the conclusion of the dental procedure, we will apply a fluoride gel to strengthen the tooth enamel and remove the gauze that was placed in the mouth. The endotracheal tube cuff is deflated. The patient breathes pure oxygen until they recover from anesthesia. We wait until we see the pet swallowing several times before removing the endotracheal tube. This is to avoid the risk of any stomach reflux entering the pet's airway before they are able to swallow and protect themselves. We will discontinue IV fluids and disconnect the monitoring equipment. The patient is then transferred to a recovery cage where they are monitored for the next 2 hours. Because half of all anesthetic complications happen during the recovery period, the intravenous catheter will be left in place until the pet is awake and standing in case of any problems. The doctor or one of the surgical nurses will call you at the end of the procedure to let you know that your pet is waking up and give you a pickup time. Once your pet is standing and alert, we will remove the IV catheter and you can bring them home. Our surgical nurses will go over everything that was done with your pet today and will show you before and after pictures. We can even email them to you in PDF format if you are keeping copies of your pet's medical records at home, which we strongly encourage everyone to do. We can also show you how to brush your pet's teeth or go over other home dental care options.
So that's the whole procedure from start to finish. Do you have any questions?
No, wow, that's very involved, and the details were great. I appreciate it, and I want to get started.
Perfect. All right. So we'll get some blood and then we'll get you started.
All right, let's get started.
Perfect.